Malik, intensive care specialist. Today I want to talk about an important topic. For the last 3-4 days, we got about 3 cases. We manipulated. We had to manipulate their shoulder. The patients, they presented with frozen shoulder. They were unable to lift the shoulder beyond a particular point. They were unable to do any movement of their left or right shoulder, whatever it is. 3 patients we have seen. All the 3 patients were diabetics. And one of them is a thyroid patient also. Other one also is a thyroid patient, but his adult doesn't know it. So it is more common in diabetic patients and hypothyroidism, thyroid patients, thyroid and diabetes. These two are very, very dangerous things where they develop shoulder. Other conditions are also there where there is trauma, etc., previous injuries. These are all reasons for, but main reason are diabetes and thyroid. These two are the main reasons. So what is exactly a frozen shoulder? It is also called adhesive frozen shoulder. They are unable to move the joint. So this is also called adhesive capsulitis. Adhesive capsulitis is a medical term. This is the joint. See, shoulder joint is a ball and socket joint. So this is ball, this is socket. So there are some muscles called rotator cuff around it. The shoulder moves. You are able to move the shoulder because of some there are about 4 to 5 muscles around. In between the muscles, there is connective tissue and collagen. Muscle, tendons, connective tissue, collagen. This is the whole structure which is around the joint, around the ball and socket joint of the shoulder, which makes movements easy. And a capsule is formed by all these things. There is a capsule. Here there is a capsule around the joint which is made by these muscles, connective tissue, collagen, etc. All these things, they make a capsule. Usually the capsule is very tough but soft, very soft but tough, and it allows 360 degrees movements. In these patients, in particular frozen shoulder patients, what exactly happens is the capsule becomes thick and it is inflamed. Means there is swelling, complete swelling and inflammation. So thick, inflamed, and it lost its resilience. It is no more soft. It is very hard. It is very hard, very thick, not soft and hard. It is hard. What I told you, it is soft but tough. Now it is hard and not at all soft. Very, very tough. That is so rough. It looks rough. So what happens is there are some when there is sugar levels go up, when your thyroid levels go up, there is something called advanced glycosylation end products. Okay, advanced glycosylation end products. Actually, this term is called AGEP, advanced glycosylation end products. These are the particles. These are the particles because of your high diabetes and thyroid. They get accumulated in this collagen and soft tissues. Collagen and soft tissues like connective tissue and all. They make it tough. And even in the fluid, synovial fluid, which is there in the joint, they look like small crystals, and the total joint, particularly the capsule, doesn't allow any movement. There is pain, there is stiffness, you can't move the joint, they can't wear even the shirt, they come in that situation. So initially we advise them physiotherapy, some drugs, physiotherapy, control of sugar, control of thyroid, etc., etc. But if they fail all these things, they come we take them into the theater, give complete anesthesia, general anesthesia. We give them general anesthesia, and the orthopedic surgeon tries to do all the movements under anesthesia. It is a painless condition. So the patient is completely anesthetized. We give anesthesia to the patient. They will do complete rotation of the hand, break all that capsule which has become very thick. They break it. We get sounds, and the hand becomes free. Then they inject steroid into the joint. They inject steroid into the joint and keep it for 1 day. They give rest to the hand. After 3 to 4 days, the physiotherapy will start. So what you are supposed to do to prevent this condition? First think of diabetes and hypothyroidism. These two, they come one after the other. First, diet. I have been telling a lot of previous lessons about thyroid. Lot of previous videos about how to control your thyroid, how to eradicate diabetes, how to eradicate thyroid. These two things I have told you before. Please try to refer them. And number 2 is, please after the age of 40, don't forget about your exercise. Walking is one good exercise, and cycling is another good exercise. But at least alternate days, try to do some push-ups. Or all the shoulder movements like this. Particularly, I advise you to do push-ups. Don't forget push-ups, which keep your shoulder very, very healthy and all the muscles of the body very healthy. So in diabetes, you are likely to develop this frozen shoulder. So even if you don't have this problem, in future you can develop it. So please try to do exercises from now onwards, at least alternate days. 1 day walking and cycling or whatever it is. The other day you do physical exercises like push-ups and whatever it is, pull-ups, push-ups, whatever it is. Try to keep all the joints flexible and fit. This is my advice.